September is National Suicide Prevention Month. So many people have been affected during this pandemic, and with Hawaii seeing its highest COVID numbers, practicing self-care is more important than ever. Joining us this morning to talk about suicide prevention is Dr. Alexander Kuduma, psychologist at the University of Hawaii. Good morning, doctor, and thanks for rejoining us again.
Good morning. Aloha.
Now, first off, what are some of the ways that we as a community can help prevent suicide?
Well, I think one of the best ways to aid in suicide prevention is to have a good support system of people in your life who you care about. Check in with others. Reach out for help from a mental health professional if you or someone you're close to is suffering. At a larger level, I think we as a community need to address some of the systemic issues that contribute to poor mental health. Things like homelessness, financial strain, inequality, trauma. And then we need to have responsive, easily accessible resources for people when they're suffering.
Now, what are some of the strategies, doctor, for talking to someone about this very sensitive and sometimes difficult topic to talk about in suicide?
Sure. Yeah, suicide can be a difficult topic to talk about, and it's a serious problem. So, any suicide threat or attempt should be taken very seriously. It's important to be able to recognize when someone is in severe emotional pain, such as feeling consistently sad or depressed, hurting themselves, or thinking frequently about suicide or ending their life. The best thing you can do to help someone is to be a good listener, acknowledge their pain, and make sure they're in a safe environment and encourage them to seek help from a mental health professional. And it really is okay to bring up the topic of suicide with someone directly. It's often best to ask about it directly so you can best know how to help them.
So where can people turn to help or maybe learn more about suicide prevention for our viewers that are watching?
Sure. Well, there are many good national and local resources to help yourself or someone if they're worried about themselves. If they're in immediate danger, it's important to call 911 or visit the nearest emergency room, as severe suicidal ideation can be a life-threatening condition. If you're having suicidal thoughts, you can contact the National Suicide Prevention Lifeline. Their number is 1-800-273-8255. And then you can get immediate assistance from a trained counselor. Residents of Hawaii can also contact Hawaii Cares, which is a locally based program run by the Hawaii State Department of Health and the University of Hawaii. They provide immediate intervention and also support through crisis, treatment, and recovery. Oahu residents can call 808-832-3100. And then our residents on neighbor islands can call toll-free at 1-800-753-6879.
All right, there you have it, Dr. Kuduma. And of course, we will have all those resources and phone numbers on our website at KHON2.com. Thank you very much, Dr. Kuduma, and you have a great day.
Thank you. You as well.